And one of the big takeaways of the next generation GST reforms will be that the medicines and also the medical health care could become affordable. How is this entire sector viewing these reforms? Joining us now is India's topmost cardio surgeon, Dr. Naresh Trehan. Dr. Trehan, really appreciate your time here on India Today. I'm looking at the items, the relief which is being said in the context of healthcare sectors. Individual health and life insurance will become nil from 18%. Thermometer from 18% it goes down to 5%. Medical grade oxygen 12% to 5%. All diagnostic kits and will go down again from 12% to 5%. Overall, Dr. Trehan, if we were to make that assessment of your sector, how do you look at these rate cuts?
Uh, it, I must say that we welcome the move the government has done. The state governments and the central government together have been able to rationalize the GST regime, and it falls under three categories. And I must say that it will be a big relief to the public because health insurance, which came under 18% GST, so that any premium that a person pays for health insurance, you have to pay an extra 18%, has now been brought down to 0%. So this is a very, very big move in favor of the public. And that means that the insurance premiums can become more affordable, and more people can come into the network of health insurance. This will be a big relief. The second thing is it comes under the medicines and medical devices. So medical devices, which used to be from 12 to 18%, some of them, like the life-saving drugs and cancer drugs, some of them have been brought under zero GST, which is a big relief for patients who otherwise had to buy expensive medicines. Second, also that there are medical devices also have fallen under from 12 to 18% to 5%. That means that now things like glucometers, which are essential for people who have diabetes, for spectacles who need as you're aging and you need spectacles, and other diagnostic kits and all will be now lower GST to 5%. So all this benefit that has been done for no matter which effect it has on the delivery system or the insurance system is all in favor of the patient, because we will all pass on the benefits that have been given by the GST Council to the patient so that it becomes more affordable for patients to buy health insurance. It becomes more affordable for them to come into the hospitals and more affordable to buy medicines. So these are things that are all very favorable. I think the government needs to be thanked for this whole move, which will give big relief to the public, and I think it's a bold step forward.
Dr. Trehan, I've been reading reports which say that crucial drugs, almost 41 such crucial drugs will become cheaper, which will essentially mean that cancer treatment, other treatments which are seen as very, very expensive will become, perhaps get in the range of a common man and a middle class.
Yes, that I think is correct statement, because what will happen is that the insurance companies and the hospitals will pass on all the benefits that have been given by the GST Council to the patient, to the public at large. Because what happens is, if you look at the principle of insurance, you spread the risk over a large base. So what happens is the insurance companies can now offer insurances, and the premiums will come lower so that more and more people can come into the network of insured healthcare insurance. So now that means that the spread can be spread over a larger base, and the insurance companies will get relief from that. Of course, that 18% tax relief will go to the patient. Similarly, whatever tax relief we get, the GST relief that we are getting in hospitals as providers, we will pass on all that to the patient so that they can be more and more people can find healthcare more affordable and more accessible to them. So I think overall, like I said, it gives us relief, it gives insurance companies relief, and most of all, it gives the patient and the public at large a big relief.
So you say that you'll be passing on the benefits to the common man, to the middle class, who come to hospitals such as yours and other hospitals for health care. The concerns have always been that will the providers be making it more accessible and affordable? So the question that I wish to ask is, post 22nd of September, what changes? Does it change drastically overnight?
So you know what it's very difficult to tell the total impact off the cuff because these are announcements that have come last night and this morning. So it has to be calculated, but I can assure you that we expect, and we will do it ourselves, and we will expect all the healthcare providers to pass on all the benefits that may have been given in this move forward, pass it on to the public at large, to the patients at large.
All,
That is a given.
all
But
right.
how much, which, in what segment, we cannot tell you off the cuff because it will be inaccurate. We need to actually process it and give the benefit to the patient. No question. As it is, you must see that the because of the inflation in healthcare delivery, there is a 5 to 8% inflation per year. That is why insurance premiums are also going up. So both of them will hopefully be reduced by some percentage, and how much benefit we can pass on will be calculated very soon and passed on. Especially that breathing time up to 22nd of September will help us to actually work out all the details and pass on the benefit to the patient.
All right, Dr. Naresh Trehan, Chairman and MD of Medanta Group, really appreciate your time. Thank you for speaking to India today. So, Swesha, this is one sector where there is a lot of concern, has been in recent years, particularly with the healthcare almost becoming unaffordable and out of reach of the common man. So, with the GST rate cuts kicking in into this very crucial sector, how will this directly impact you and me? That is what perhaps we'll get more clarity when they kick in on 22nd of September.
Oh, yes, absolutely. Maria, thank you for those inputs and, of course, getting us all the important voices ahead of this big development.